we're live. I'm going to get it live on Instagram now. Although it'll take a couple of seconds to get us live on Instagram. But welcome in. Where we welcome to our episode 14, which honestly I cannot believe we're already on episode 14. That means it's been over 2 months of us doing this because we did miss 2 weeks there. So 2 months. It's more than what is that? It's more than 2 months.
Well, there's 4 weeks in a month, so
3 months and a little bit, yeah. So basically 4 months because we missed out too. I said 4 months, right? Did I say 2 months? I don't remember. It doesn't matter. Welcome in. We're just
14 episodes.
14 episodes. We're just massage therapists, which means we are just people. We're just women. We're just mothers and wives and whatever it is that we are. We are just massage therapists. These are just our opinions. And yeah, today we get to have a fun conversation. I'm just waiting for Instagram to let me go live. There we go. Instagram is letting me go live. So as you come in, I will be able to see your comments, or we will be able to see your comments on whatever this thing is called, YouTube. Oh my God. Just right in the chat, and Instagram, I'll be able to see your comments as well, and we can chat that way. So I'm very excited. I know a bunch of people told me they were going to possibly jump in today. So yay, more people. I have my squirt. I have my emotional support hot drink.
I got none of that.
Cora ain't got nothing.
I got my knitting loom.
Oh, that's good. My headphones are still not working with this laptop. I'm real irritated with that about this laptop, so I'm gonna have to figure out what the heck is going on. I'll get the internet to be perfect and everything's working and I don't have to worry about anything, but then the Bluetooth just doesn't exist anymore. And then I'll get the Bluetooth working and then the internet goes all crazy. I don't know what's going on. How are you doing, Cora?
Good. Finally got some sunshine. Went to save some earthworms the other day because we got rain. We weren't able to save a lot. Most of them were already sun-baked by the time we got to them. But we got to save some.
Oh, good. I'm glad you got to save some.
We let our pet ladybug go today too. We found him. Oh. We found him hanging out by the piano in like January, and then we put him in a little container with some raisins and water, and then he got out, and then we found him again like 3 weeks later, and then we just let him go today. Yeah, my girl found him by herself. Oh. And his name is Apple.
Yeah.
Apple.
I love that name. That's a great name.
Apple Peach.
Apple Peach. Love it.
Yeah.
Makes me very, very smiley.
Goes with our fish, Lucy Grape. Or slash Gary, depending on which one you're talking to.
Oh, right.
Gary or Lucy Grape.
Lucy Grape's name Gary.
It's Gary.
Yeah. It is Gary.
So apparently it's Gary, SpongeBob, and Patrick. Those are our fish's names.
Oh, I love that. I love that for you guys.
You said Gary. You said the purple one was Gary.
Huh?
You said the purple one was Gary. Should be Squidward.
Should be Squidward.
Flame has Gary. You want to go scooch?
Nope, I will play.
She's able to play water today. She's super excited about it.
Ooh, that is very exciting.
And drinking mud tea all day. So yummy.
Mud tea is the best kind of tea.
It was watermelon tea, actually.
Mudland tea. I mean,
yeah, you got it.
That is absolutely hilarious. Well, what are we talking about today, Cora?
I think we can maybe talk. I think we should maybe talk about client retention today.
Yeah, I think that's a good choice. I love how we do that. Like we didn't talk about what we were going to talk about. We 100% did. That was just a really bad bit. Or did we?
Who knows? This is us.
Yeah, a little unhinged, kind of ridiculous, but we laugh a lot. I think it's probably the thing I love about us the most is that we laugh a lot. And although we may have a plan for what we're going to talk about, we end up talking about so much more.
Yeah, it's just a guideline, like a
Yeah.
rule.
That's true. Oh, client retention. This is always it's always kind of a hot topic in really any manual therapy world, right? I mean, doctors, nurses, they got their hands full because people get the kind of sick that they treat constantly, and they don't generally have to think about client retention, but massage therapists, chiropractors, acupuncturists, energy healers, craniosacral, all of the things, all of us, we're constantly having to think client retention, or we choose not to think client retention and just let it go as the wind decides. So, I guess really the first thing that we want to talk about is our ideas on do you, and I'll ask you first, Cora, do you have a client retention plan that you stick to, or do you sort of have a loose idea, or do you just let it blow with the wind?
It just kind of depends on the client themselves and what they're presenting with. That's like I always have a plan, a client retention plan in itself, but as far as like how far I actually make a real plan with them very much depends on what they're presenting with.
Can you give me an example?
Well, for example, if everything I look at in their chart is general full body relaxation massage, it's come back when you need to kind of thing. But I'll never let anybody leave without stretches or home care or my 2 cents on what I think should happen. Just kind of planted those seeds. But then there's other clients that say have had back pain for years and they haven't been able to figure out why. Those are the ones where I'm more, so these are my special tests. This is what we found. This is what I want to see. This is what I want to see from you. This is what I want. This is where I see us in the future. But then that's when I really get into depth with the plans. When they actually, especially the ones that actually want to help themselves. Once we get, and if we have those clients that present with a condition that we can work with, but they don't want to help themselves and they're not willing to take healing into their own hands, then that's when that plan becomes a little bit looser too, because I can tell them what I want and I can reiterate it as often as I want. But if they're not doing the work, at the end of the day, I'm just taking their money. So if that's what they want, that's fine, but I'm not going to push for them to come as frequently as I feel like they should if I know they're not doing the work, therefore they're not going to get that progress. Does that make sense?
It does. It makes actually a lot of sense. I mean, for those types of clients, the third ones you were talking about there, they have a tendency to shift blame as well. Mm-hmm. If they don't want to work on themselves, then they'll say, well, you said to come on this and we were supposed to be getting better, but I'm not getting better. What are you doing wrong?
Yeah, well, and that's where I'm very open with them too. One sec, baby. Oh. Okay, I'll help you. With that too, I'm very clear with my clients that I'm a facilitator. All I do is facilitate. I give the tools, but they are in charge of their healing journey. And if they actually want progress to be made, then then it's important that they take that step.
Yeah, I agree. When do you think the beginning of client retention is? Like, when does it start for you?
When you say hi.
Yeah. I'm of the same mind.
Yeah. So like when you present yourself and just because the clients don't come back to see you particularly doesn't mean that you're not good with client retention, right? That's something to remember too, is some personalities vibe, some don't. Yeah. And massage is very much an art form. So just like music, everybody's going to have their own style and everybody's going to have their own preferences. So it's important to remember that too.
Yeah.
As a therapist. But initially it comes into actually saying hi, bringing them into the room and then actually showing interest and trying to find out what's wrong. As soon as you start to find out what's wrong, then that automatically makes the client want to come back to see you.
Why is that, do you think?
Because you care. And they see that and they're like, oh, you're looking for answers. And even then you get those clients that are like, oh, well, I don't, they're already like dressing down while you're saying hi, while you're going through your informed consent. That's a thing that happens. Any massage therapist knows that. Any person, any practitioner,
any professional in
any professional in which your clients disrobe, you know.
Yeah.
But even so, then even I'll just draw attention to what I'm finding. I'm like, oh, so your pelvis is out rotated here. Do you have this is your problem side, correct? And I'll just kind of draw my conclusions based on what I'm seeing. Their postural on the table. And then they're like, oh yeah, how did you know? And I'm like, oh, just the way you're carrying yourself. So this is another reason why I want to do these special tests.
Yeah.
And then they're like, oh. And then the ones that I can do on the table, I'll explain what I'm doing. I'm like, so this is what I found. And actually with the whole diagnosis thing, I was actually looking into things, and there's actually we're actually not allowed to diagnose. We are actually allowed to make clinical diagnosis.
Yeah, that's different than a diagnosis, though.
It is. It is a diagnosis, but we can still state what we find. So this test is assessing for tendonitis, and you're positive for it. So, or working diagnosis, not clinical, a working diagnosis. We're able to establish a working diagnosis.
Yeah.
So
I really like that terminology specifically. The working diagnosis is really nice.
Yeah, it's because it's not we're diagnosing you or we're going to give you something for it, but we kind of are. We're giving them stretches in home care, but we're still educating them on like, these are the symptoms. Mm-hmm. This is the definition, and this is what it is.
Yeah. Which I feel like we get an opportunity to spend that time with our clients in more manual type of practicing than doctors do. Even doctors of chiropractic don't get that much of an opportunity. I know I loved when I was there. I loved my chiropractor, Dr. Dan. He would always take the extra couple of minutes to talk to me about things and not just feel, do, and say, okay, see you next week. He was phenomenal. But the truth is, I've been to quite a few who have never done that. Right now, I know as a massage therapist, as a manual therapist, that talking to my clients and letting them know what's going on and what I'm finding up to their understanding level. Of course, you can't go over their level of understanding, right? But up to their level of understanding, they have a tendency to be more interested in rebooking or coming back, even if they don't need it. Right. Mm-hmm. So after I was finished with, and I love talking up Dr. Dan because he's just awesome. But after going to visit him 3 or 4 times and the root issue had been addressed and I'd been realigned, right, I didn't want to stop going back to him. I didn't go back to him as often, right? At that point, I was going back twice a week, but I still went back to make sure everything was aligned and if he found anything else. Right. So just from my perspective, knowing what makes me want to be able to come back to a treatment or a practitioner.
Yeah. And that's huge too, right? That time and the listening.
Yeah.
I know the chiropractor that I would see, I haven't seen a chiropractor in a really long time.
Sorry. That was dramatic.
I should, but I don't know. It's always my C1. My C1 sublux, and then I have a headache for a week, and then they adjust it, and then I have a headache for a week, and then I move my head wrong, and I have a headache for a week. So it's just one of those where it's like, I'm okay with a crooked head and no headache.
Crooked head and no headache. Yep, that's... Yeah. Sometimes, I mean, what's one of the first things we learn in massage school? If it isn't broke, don't fix it.
Yeah. I don't know. But as soon as my C1 subluxes again, then my curves, I'm back to 5 curves.
Oh, yeah. Like, if it breaks,
4
fix
curves.
it. But if it isn't broken,
So
I don't know.
Yeah. I'm just kind of like riding it out, just trying to like do a collapse crawl and make adjustment, like trying to like bring balance back into me with my scoliosis. But I don't know. I'm kind of I'm gonna have 2 curves regardless of what I do, so that's what it is. But
Yeah,
the other 2 I can work with.
I can definitely work with those ones, stretch those ones out a little bit. Do you remember? I don't remember if it was you or not, but the very first time I ever had a lower back spasm, was it you that was there that day? You had to
You're
come
on
and
the
get me
table?
off the floor, basically.
Yeah, that was me.
Oh, that was intense. So funny. I was thinking about that earlier today, and now you bring up your neck and stuff. I've been thinking about it because he's been having the lower back spasms, and I've been trying to help get him through that moment. But even with that, and here's the fun part: I was getting a massage. I didn't know that I had anything out in my back at that time, and it was student massage therapy. She's an excellent massage therapist now, but it was just one of those like I didn't know. We didn't do enough testing to find out if there was something on. I don't even know if testing would have found out that I had an issue with my lower back.
Yeah, they would have had to do the right one.
Yeah, exactly. And I mean, you only have so much time. But the way that she was able to, in that moment, she was quite calm when I was getting off of the table. And she was able to come and get you and deal with it really, really professionally. I wouldn't have been scared to go back to see her again just because my back got hurt. Right? Because I know it was not her fault.
Well, and that's the thing too, right? Is owning it, right? If it's just like, oh, but if you, because like I've had situations in the treatment space too where I have kind of triggered a spasm, like unknowingly, but it's all again on how you address it.
Yeah.
Right? If like I recognized it pretty much immediately, I took care of it.
Yep.
And that client is a regular of mine. But if it would have been like if I wouldn't have recognized it or been aware, and I don't think he would have said anything. That's just who he is, just the kind of person he is. He wouldn't have said anything. He would have just suffered in silence and then just not gone back.
Yeah.
Right. But yeah, it's owning it too. When if you like feel like you might have done something that's going to cause inflammation or going to be sore, it's owning it, because that also instills that trust. And it's when the trust is broken.
Yep.
That's when the client won't come back.
Yep. And that trust does really start the moment that they walk through the door, because especially first timers in your clinic or first timers to massage itself, they feel a little self-conscious, a little uncomfortable. Not everybody, but a good majority will sit in the chairs in the weight room and be like, okay, and they're a little, and the moment you step up and you present that friendly yet professional atmosphere that gives them the calm to be there, it's the first step in, you know what, I think I want to come back to this person.
Mm-hmm.
It's the not rushing. Rushing without rushing. Have you perfected the rushing without rushing yet?
I don't. My brain doesn't feel like I have. Because I feel like when I'm rushed, I'm like, oh my goodness. But one time in particular where I felt exceptionally rushed. So I was very much like, how can I? She was late. And I had a very short amount of time. I don't remember if it was a 90-minute. Oh no, it was only like an hour or maybe a 45. Anyways, it was a shorter massage. She was about 10 minutes late. By the time she got on the table, that was 15. Mm-hmm. And I was just like, oh my goodness. And she wanted her back, neck, glutes. And I was like, okay, we don't have a lot of time here. We don't have a lot. So I felt really rushed. But afterwards, one comment she did make was that I was very thorough and not rushed. So
that's nice. So your brain was playing tricks on you.
It always does, though. Yeah, it always does.
I find this, there's a fine line between being rushed and rushing the treatment. You know, because you might in that moment actually be rushed because you know you only have so much time. But actually rushing the treatment means that you aren't doing what you need for that. You're just going through the motions trying to get through each area of the body. I highly doubt you have ever done that in your life. I can't imagine you doing that. right?
If there's any area of the body where I do that, it's like the anterior cruce, like where just tibialis anterior lives.
Well, 2 other muscles are there too, but yeah. You know me, I love the forearm and hands and the shins, the calves, the feet, all of it. I love all that stuff. But yeah. No, I get it. I get it.
Yeah, it's pretty much the only, and I tend to focus, and in that situation, I'll tend to like just do a couple strips along the tibia, making sure I'm addressing gastrocs, tib post, like getting those guys, making sure I'm getting those guys. But that would be the area where I just kind of go through the motions without, but not actually. It's like attachment sites, I guess. I do more origin insertion work there,
which is actually really, really awesome in those areas. I need to we need to just sit down and like have a fun leg day, you and me just talking about the leg and like getting you loving it a little more. Not the leg. You love the leg. I know you love the leg. I meant from below the knee.
No, I like below the knee too. I like it.
On the front.
I don't like the ankle. The ankle down.
Okay, we'll work on the ankle down. It's so exciting. Like it's an exciting area of the body. It's just like the hands where there's multiple planes you are working with. And that's always super fun for me, right? Because the hands, the freaking ridiculous thumb on its weird plane that isn't on anybody's plane except for its own. It's weird little oblique plane. And then the ankle that goes from this plane to this plane.
Yeah, I'm not. Yeah, it's just, I don't know. I learned to, I got on coffee terms with it. I got on coffee terms. It's not a, hey, let's go and smoke coffee or smoke cigarettes and drink coffee for 3 hours by the river coffee terms. It's a, let's go have a coffee. See you next week.
Yeah, sitting at Timmy's and having a little sipperoonie
in a crowded environment is not a coffee with friends.
Oh, so you're at a like a mall cafeteria.
Sorry?
A mall cafeteria.
Yeah, with the ankle and the foot and the hand. Yeah, that's exactly where I am. Yep, but we're still having coffee.
Oh my god, I love all of that.
Do the dollar store walk. And we go our separate ways. We're not sharing vehicles.
Oh my gosh! Anybody who is on, if you want to comment on the way that you like to explain things to people, do you use ridiculous metaphors? Oh my gosh, your metaphors are amazing. I love them and they make me smile so much. Oh my gosh. Oh. Anyways, back to client retention. The day. I find that there are a couple of things that will always stay constant when it comes to client retention. I got the dog behind me. You got the kids burping yours behind you. So but there are a couple of things that always stay consistent with client retention and helping people feel like they're more confident in coming back to you as opposed to going to someone else. And that the very first one is the interaction, that personability between you and the client that you're talking with, right? Being able to adopt and adapt your personality and your vibe to their level, right? Not everybody's personalities are going to mesh. I get that. But being able to put your energy at the same vibe as theirs is, that's kind of my step one. It's always my step one is to try and find where they are at, right? Are they giving off a lot of energy? Okay, I'll come just below them. Are they giving off a low energy? Okay, I'm going to just above them. Sometimes I'll end up doing it right in the same energy line. Oh, families, we love them so much. But that's usually the first one I go with. The second one is creating a very individualized experience for them. And that comes from what assessments we're going to have, how I ask my questions. I will change how I ask my questions based on the client and based on how they've answered the things in their case histories and whatnot. And the general vibe, right? I'll ask my questions based off of that. I'll create the treatment space and get them on the table a certain way, and we'll right? We'll go back and forth, and it becomes more individualized because I'm allowing the back and forth a lot more. And then when it's on the table, I have a tendency to just shut my mouth. If they want to talk or if I have questions for them, then I'll talk with them. But I usually just keep it quiet in that space so that they can get into rest and digest. So creating that personalized experience where the talking is governed by them.
Mm-hmm.
They get to govern the experience. I get to provide the experience. They get to govern it. And then having things ready. The third thing I always have is something ready for them, whether it is a take home or something I'm going to email them or send them later to say, this is what is going to be better or best for you. Here's your treatment plan. And I always have a treatment plan, regardless of if they are relaxation, full body, or just an area relaxation. They don't want any work done. They just want to chill. I will still have a treatment plan for them based on what they've told me about their life. You're just having a time today.
She's closing me off. She's like, you're on a call. You're over here.
I love it.
I don't know what they're doing over there. I'm just gonna be here.
But those three things always tend to create retention, right? Even at times where I haven't done what I would call my best work. I had this is just a quick story. I had a client a few months ago, probably closer to a year ago now. Ugh, that's crazy. When I was still back in Watrous, and she was really scared of painful treatments, and like she had a lot of fear. And I'm more of a lighter therapist. I like to stay on the light side, not the dark side. Sorry. And I gave her a very light treatment. We did get into a couple of things where I got her to do some active movement, which always causes a bit of soreness. She talked to me the next day. Like, I had an opportunity to talk to her the next day. If she hadn't contacted me, I would have been contacting her. And she said, hey, is it normal for this, right? And it was just a little bit of kickback pain. I'm like, yep, all the stuff that I told you to do, if you do that, that's going to go away very quickly. And this is someone who had experienced headaches for days on end. And after that treatment, she didn't have any. She had a little bit of soreness the next day, but no headaches for over a week. So it is that communication back and forth, creating very specific things for them. Although we kind of have a guide, but creating very specific treatments and saying, this is when I want you to come back. This is what is going to work best for you. And for most people, if you tell them that, they will comply with it. Most of the time, right? I would say anywhere between 70 and 80% of the time. Just make sure that you're not wasting their time.
Yep.
Yeah.
I get ethically, right? That's an ethical thing.
Yeah.
Is not wasting their time.
It is a huge ethical conundrum.
And recognizing too when you've done what you can for them. That's huge too. Because they will respect that.
Surprisingly enough, when you say, hey, I've done everything I can do, or for this particular issue, I can't do anything here. I need you to go and see this person. That also creates retention for yourself. Mm-hmm. As counterintuitive as that might seem, saying, go to this person, go do this, even if it's another therapist, like massage therapist or therapist in your field, the retention ends up usually coming back on you.
Truth.
Because you're looking out for their betterment. And that's, I mean, isn't that what we all are looking for? Yeah.
Excuse me.
Got another quick question for you, Cora, because, I always have questions. What would you say to a new massage therapist, someone who is just fresh out of school, starting their practice? What would you say to them to help them on their journey of retaining clients and getting clients to book back in?
Act confident. Don't be afraid to say you don't know something. Put on that confidence for what you do know. And if you don't know it, just be, I'm not sure, but I'll get back to you on that. Not timidly, but I'll get back to you on that, and get back to them, because they will. That's huge.
Yeah. Don't say you're going to get back to someone and don't.
Yeah. Make sure you do it, and they will respect the fact that you don't know and you've told them you don't know, because they can smell BS. Maybe not initially, but they'll eventually be able to smell it.
Doesn't matter how much perfume you cover it in.
Right. Shit is shit.
Please don't wear perfume. You don't want to cause somebody with allergies to flare up, but yeah. If there are people, and I know this is the fear that a lot of people will have, is they say they don't know something, and the person starts to judge them, and that fear of being judged by your client for something you don't know. First and foremost, that doesn't happen very often. It's actually quite rare. They look at you and they go, "Oh, okay, cool. Maybe that's just something that they haven't gone through, or they don't even think about it after that point." And they go, "Maybe I'll look it up, or I'll ask somebody later." Or you say, "But I'll look it up." They put it out of their minds. Or the very slim percentage of people who actually do judge you when you say you don't know something, most of the time, those are the people who will not listen to anything you have to say, regardless of how well you put yourself out there, how confident you are. Those are generally the people who will tell you how to do your job while they're on the table. Have you ever had one of those, Cora?
Yeah. Actually, I had a client who had, I'm so sure it was radial nerve lesion. She wouldn't let me do the testing though. She's like, "No, you just gotta come. It hurts right here. This is where you have to go." And I'm like, "Okay, but we should go to your." She's like, "No, it doesn't hurt my shoulder. Leave my shoulder alone." I'm like, but it's all connected, so we should go to your shoulder and your neck. And she was having none of it. She just wanted her from the elbow down. I'm pretty sure she had like radial nerve something, but she wouldn't let me do anything. And I was just like, well, if that's what you want. And then she's like, "Has this ever happened before? Have you ever experienced this before?" And I was like, "Well, yeah. And the impingement is usually up in here or back here." And she's like, "Oh, that's not where it hurts though." I'm like, "No, because everything distal to the nerve is where you're going to feel it. Everything distal." And she's like, and then I never saw her again. And that's okay.
That's the thing. If they don't come back, they're probably not for you.
Yeah.
They're probably not for you as therapists. And yeah, money lost from that one client, but that means money gained from people who want to come to you and who actually want to get better and not tell you how to do your job.
Well, and even like the people who do, like I've had other people who've been telling me what to do, but they were open to education. So, and that's the big thing too, is with I'm big on education. I can't even stop myself. Like sometimes I realize what I'm doing. I'm like, do you want to know? And they're like, "Yeah." No, okay. So then I'll keep talking. But I have a really hard time not educating, especially when people are like, "Oh, my shoulders hurt," and I'm coming in there. And like I can see that their pecs are tight. I've done the assessment to see that their pecs are tight, but they're like, "I need you to massage back here." It's okay. And I'll get in there and I'll just explain to them that if it's tight, yeah, but it's a tired tight. It's not an overworked tight. Yep. And they're like, "Oh, well, what's overworked then?" And then I'm like, "Oh, your pecs are." And then that's when they're actually open to hearing me. Like I had a person the other day who wanted me to cup his upper back, and I looked at his shoulders. I looked at his pecs and I was like, "I'm not confident cupping your upper back." I said, "I don't feel like it would benefit you therapeutically." I said, "Your glutes, we'll go to your glutes. We'll go to your low back. We'll go to those quads 100%. I said, "But your upper back, I feel like you were better off if we cup your pecs." And he's like, "You can cup pecs." And then that's the thing too, is lots of times people like some therapists, they get clients say client wants this, therapist does this. So coming back to that, like looking at what they're actually presenting with and looking for the cause and finding there's always a cause. What they feel is a symptom. it's not what started it. It's what the domino effect created. So that education in directing them where they actually need to stretch, where they actually need that treatment. And that's huge too. Because they're like, oh, nobody has done this to me before. Nobody has done this for me before. Like I'm huge for the psoas. I'm huge. I love the psoas so much. It's my favorite everything. But it's not a treatment that you're like, yeah, we're just going to get out of the psoas. You don't do that. That's something they have to mentally prepare themselves first.
Yeah.
So I'll start with a stretch. I'm like, so do you feel this? And like, yeah. I'm like, that's the muscle I want to work. And then I'll pull out my textbook. And then all of a sudden the light bulbs are going off. And 9 out of 10 times within 2 treatments, we're like, let's do the thing. And then we do it.
Oh yeah. Yep. Usually it's 1 or 2 treatments before they'll let you go in there. Sometimes same with the pecs, 1 or 2 treatments. The abdomen I have found is fat, like just the abdomen, not going into there. I have found not even a full treatment do I generally have to wait for people to let me do just an abdominal massage.
See, that's not what I really promote. I incorporate it into the psoas or the diaphragm if it's needed, but unless they're constipated, I don't really target the abdomen.
Oh, I love treating the abdomen. It's one of my favorite locations, aside from hands and feet. Hands, feet, face, skull, those are my top. Always will be my top.
Relaxation points.
Yep. And seriously, that is one of the biggest things I want to do with right. The majority of people, if they have a really major issue, right, I want to do the relaxation, treat the major issue, find it, treat it, and then go back to relaxation so that they can stay in that rest and digest mode as long as humanly possible, because that will do more for them than any painful treatment I'll ever do. My opinion. My opinion on that one.
Yeah, see, I don't really consider myself to be a deep therapist, but I'm very specific. So they usually feel whatever I'm doing.
Oh yeah.
Yeah, not like to that pain threshold. I don't like to take them to that pain threshold, but they're aware. They're aware.
Yes, they are. I do want to show you guys. We just threw this guy up. I'm just gonna switch the visual here. We just threw this up onto the website. We finished it a little while ago. It's not up for candid credits for MTAS or NHPC yet. But this is the Client Retention for Wellness Professionals course. It is about 3 hours to get through. NHPC will take the credits for it, but we're going to be waiting on MTES and CMOTA for a little while. But you'll notice here it's a 5 module. So it's got the introduction, the client experience, the strategies and follow-ups, the concerns and feedbacks, and then marketing as well. It's one thing we haven't really talked about today is marketing for retention. And then resources that will accompany it along with the exam, just the short little, it's like I think a 10 question little thing just for getting your certificate there for it. So you can get to this guy through the online courses, or of course you can always sign up as a member and get access to it for free. But yeah, this one will help you sort of just dive into and ask yourself the questions that you need to ask yourself to say, okay, am I really doing the best that I can to retain my clients, and how can I do better for them, including creating really good treatment plans, which is one of the big ones. I also want to make note here on our main page for upcoming events. Saturday is the knee, so we're at the last day here where we'll be accepting applications to join the musculoskeletal review of the knee, or the joint and anatomy review of the knee. Remember, every time you take one of these, knee and ankle, I guess, you'll have access to the online classes that are part of the price, and you'll get the credit for not just going to the review, but also the course, the online course as well. So Just want to remind everybody that is there. Our wonderful podcast visuals are there. And upcoming in May, we've got a few things as well. We've got the live review for Systems of the Body. We've got 2 different ones. We've got the elbow and wrist joint review on the 24th, and we have 4 spots left for the cupping on the 1st. Aside, of course, all of our podcasts on the Thursdays, which will just consistently be there. If you want to know and see that schedule, you can use the QR code up at the top here. Oh my God, I forgot what it was called. The QR code there. Remember, if you join as a guest member, the first course that you take or the first thing that you purchase from the website, 50% off. And you also have access to one free course, the personal self-care course, in which you go through a bunch of the stuff that Cora and I have already been talking about today. So if you aren't part of massage or manual therapies, but you want to learn a little bit more about your own self-care, please go and grab that course. And then if you want to go further, we can chat. We do consulting with that as well. Woohoo! Therapists, if you are wondering how can I help my clients better with at least the home care side of things, and you take that course, you'll already know almost everything that's in there. It's just a really good refresher for you, and you get some good credits out of it. But then you can also do consultations with us as well. So we can do group consultations, one-on-one consultations, and for those, for both CMODA and NHPC, you do get credits for those, and you don't need, we don't have to have them approved through them. They're personal interest type courses, so you can have a few of those every year. So you're always welcome to come and chat with us. We've got a lot of years of experience in not only the educational side, but in the actual treatment space and working with clients one-on-one and in groups. So please feel free to utilize us as much as possible. We are, I believe, a great resource. So, yeah.
And I just wanted to put it out to the clients out there. What makes you feel like you want to come back to a therapist? I'm always, put it in the comments. Let us know.
Yeah. So if you're watching this right now in the live, I am looking at the comment sections back and forth if you want to say anything there. But if you're watching this later on when we've got it posted, comment. Please let us know what you're looking for so that other therapists that come and watch these later on get an opportunity to see what you need. Having open communication is probably the number one thing that we want.
Yep.
That was cool. I enjoyed that one. I do love talking about client retention. I got a couple of things up on our Instagram and our Facebook on client retention. Yeah. I don't really have much else to add right now. Do you have anything else you want to add into the conversation, Miss Cora?
Not really. Nope. I just thought of that question for the clients. That shout out to the clients.
That's really great. I love that. All right. Fantastic. Well, thanks all for coming and joining and hanging out with us for a little bit. We are Just Massage Therapists, and we will see you next week. Bye.